I'm Matt Sherman, the Digital Curation Librarian and co-chair of the Scholarly Communications Working Group here at Drexel University Libraries. And welcome to our last Open Access Week 2023 talk, hosted, of course, by Drexel University Libraries. Open Access Week is a global event promoting access to knowledge, highlighting open activities, and promoting actions that will make more scholarly and educational materials freely available to teachers, learners, researchers, and the public. Today, we welcome Doctors Usama Bilal and Josiah Kephart to speak to us. Dr. Bilal is a social epidemiologist and assistant professor in the Urban Health Collaborative and the Department of Epidemiology and Biostatistics. Dr. Kephart is a climate epidemiologist and assistant professor in the Department of Environmental and Occupational Health and the Urban Health Collaborative. Their presentation today is entitled Leveraging Open Access and Online Interactive Applications to Disseminate Urban Health Research. They'll speak to us for about 50 to 60 minutes, followed by a few minutes for questions. You're welcome during the question and answer portion to unmute and ask your questions directly, or if you would like to put questions in the chat, I will read them off to our speakers at that point. Now, without any further introduction, Drs. Usama Bilal and Josiah Kephart.
Sorry, I clicked the wrong button there. Okay, so thank you for the kind introduction, and thank you everyone for being here today. So today we want to talk about a project with both Josiah and I have been involved in, and how we have used open access and online interactive applications to disseminate parts of the result of this project. And how our experience has been in sharing these results, and how it, especially they have helped us communicate with media. We'll use two examples today, one on inequalities in life expectancy across Latin American cities, and the other one on the effects of temperature and mortality in Latin American cities. Now you may wonder, why Latin America? Why are we doing this in Latin American cities? Well, a key reason for this is that Latin America is one of the most urbanized regions in the world. You can see here data on the proportion of the population living in urban areas, and you can see on the bottom left, Latin America growing more than any other region during the later parts of the 20th century and beginning of the 21st century. So that now Latin America and North America as a whole are the most urbanized region in the world, with around 80% of the population living in urban areas. Now, apart from that, Latin America also happens to be one of the most unequal regions in the world. I'm showing here data on Gini coefficient of income inequality, and as you can see, apart from the southern cone of Africa, Latin America is the other region that is darker on this map. So Latin America is highly urbanized, highly unequal, and to study how this has consequences on health, Drexel had led the SALURBAL project, Salud Urbana in America Latina, which was a 6-year project, which is ending next Tuesday, actually, October 31st, but it has been renewed for 5 more years to focus on climate, specifically climate and health. It's been funded by the Wellcome Trust, led by us here at Drexel, with Anna Thierru as the PI and 14 other partners in Latin America, which are distributed all across the region, plus a couple partners here in the US. Now, in this project, we essentially want to examine how is the health and what drives health of all cities in 11 countries in the region: Argentina, Brazil, Chile, Colombia, Costa Rica, Guatemala, Mexico, Nicaragua, Panama, Peru, and El Salvador. And in each of these countries, we have selected all cities with more than 100,000 people by 2010, and studied and collected data on all of these cities. Something that I always find very interesting about this study is that we are not just focusing on the big bubbles here that you can see: Buenos Aires, Sao Paulo, Mexico City, cities that You think about Latin America, the first cities that come to mind, but also everything in between here. That's actually where most of the population lives. Most of the population do not live in the biggest cities. They actually live in the medium-sized cities. So we are studying all of them here. Now, I'll be presenting this example of life expectancy, and then following that, Josiah will be presenting the temperature example. So with life expectancy, I'm going to be showing examples from this study we published on Nature Medicine in 2021 called Life Expectancy and Mortality in 363 cities of Latin America. We use data from those 363 cities, which were the ones for which we had data at that point. We are just missing Nicaragua and Guatemala from there. And we computed life expectancy, which is a measure of if a newborn is born today, how long are they expected to live if current mortality patterns hold in the future. So it gives us a way of understanding mortality data in years of life, which is quite intuitive. And then apart from looking at that, looking at life expectancy, how it differs by city, we also look at what are people dying from, what is proportionate mortality by large groupings of death. And, apart from the paper, the manuscript, which you can go online, is actually open access because the funder, the Wellcome Trust, actually mandates us to follow Plan S, and all of our results have to be open access in transformative journals. Apart from that, we also developed an interactive application to highlight the results of this study. You can go into this link. Sorry. And I'm actually going to copy the link in the chat in case people want to follow along. And this is an application we developed to highlight and to let people explore the results of this study. This was one of the first ones we developed. You'll see with Josiah's one, it looks much prettier and everything looks much better, well designed, but this was one of the first ones we tested here. So this is linked as part of the paper, but it's also completely independent from the paper itself. Like people can just come here on their own and find this. And one of the things we do here is explain what we are showing in this app. Then we also have a link to our GitHub repository where the code used to produce all of these results is also available open access here. And both the manuscript and the derived data and the code are being licensed as a CC BY license, which again is part of the mandates of the Wellcome Trust as the funder. Now, just going to show you a few results here so you get a sense of what we found in this study. What I'm showing here is life expectancy for men for a second. Life expectancy for men in each of the cities of the region. Each of these bubbles here is a city. So, for example, this one down here will be Acapulco in Mexico. And each of the columns corresponds to a country. So all of these are all of the Mexican cities in our study. And one of the things you can see here is that there is actually a lot of variability within the same country. So within Mexico, we actually have almost 10 years of difference between the city with the lowest and highest life expectancy, meaning a newborn born today, well, a few years ago, where this data is from, in Acapulco is expected to live around 64 years if current mortality patterns hold, while a newborn born in Mérida, Yucatan, is expected to live 74 years. You see 10 years of difference between two people born in the same country, different city, but same country. We found a similar thing in Brazil and in Colombia, where there were very wide differences within the country. We also found a similar pattern in women, and actually that's a nice thing we can do here. We can change between men and women and see one or the other. We can actually see life expectancy at different ages. Instead of a newborn, we can say, if you are 40 today in this Mexican city, you are expected to live 37 more years, for example, if current mortality patterns hold. We also allow you to see whether, these patterns are due to a lot of variability. It may be that some of the cities have actually, very wide, a lot of uncertainty. So here we can actually zoom in and come and see, let's see Juarez down here. So life expectancy is expected to be in women around 75 years, but there is an uncertainty band there to tell us, well, are we very certain about this or are we not? And we can actually explore this in all of the countries, and we can say, well, let me just zoom in down here. I want to really see what's the life expectancy of Antofagasta in Chile. So we can go and see at the specific results, but we can also look at this within a table. We can say here, I want to see what the life expectancy is in Sao Paulo. I search Sao Paulo and I look for it here. I can also download the data. Remember that's going to be important in a minute. We can also look at maps. Maps are actually a very powerful sharing tool because when you show people a map, people tend to go to where they know. Like if you know Mexico and you have been in somewhere in northern Mexico, well, maybe you want to go here and see what's the life expectancy in Acuña or in Juárez. You can come here and check that. The other part we show here is the proportionate mortality. I'm not going to focus a lot on this. The key thing here is that we are showing for every city what proportion of deaths are due to every cause. And for example, we can see here that in Acapulco, here on the right of this map, 19% of deaths are due to homicides. So 1 out of every 5. While down here in Mérida, it's only 2%. So 1 out of every 50 deaths. That's a tenfold difference there. It's a huge, huge difference. You can also download this for all of the cities. You can click here and download it. It will download a CSV, so you can go and check that. And you can also check this in a map too. So you can check how, for example, violence varies within Mexico, for example. Now, I'm showing you the results of this application, not the interesting peer-reviewed part of the paper, because at the end of the day, what we got media to care about are these kind of very simple results. And I'm showing here a piece from BBC World Service for Latin America, which is called BBC Mundo, so BBC World. And they essentially went to our dashboard when we published the paper and we reached out to them. They went to our dashboard and downloaded some of this data, and they created their own figures here, actually. And they have 4 figures that show the big difference in life expectancy between cities in Latin America. And as you can see here on the left, it's similar to that last figure I showed, but it was like vertical. Here is horizontal, and they just chose a few selected cities. Actually, when I talked to the journalists on the phone, they asked me, oh, which cities should we choose that show a variability in interesting things? And I told them about all of these cities. And for example, here, you can see they chose Puerto Seguro, Acapulco, and Cali, and San Salvador as cities with higher levels of violence. And you can see here in maroon, I guess, or dark red, that proportion of deaths that are due to violence, 20% in these cities, 14, 10%, as compared down here, for example, to 2 or 3%. But we can also see death due to infectious diseases or cancer or non-communicable diseases or accidental injuries such as traffic accidents. All of this is taken directly from here. They went to this table, they look for that city, Puerto Seguro, and then they look at that. Or they actually click here and downloaded the data and play with it. But all of it was available here. The only thing we did is tell them a little bit of context about the cities, but they were the ones that downloaded the data and did something with it. Same thing here on the right. This is they downloaded the life expectancy data for several cities in Mexico, showing the big differences within the country, those 10 years that I mentioned, and between Acapulco and Mérida, for example, and they did the same thing for men and women. They actually even showed maps. I'm not showing maps here today because they had some bug in the news piece and they were crashing when I look at them, but they also had maps that they got after downloading our data. So that's one example. The other one I wanted to talk about today is this one. It's another article we published, in this case, in the Lancet Planetary Health in 2019, entitled Inequalities in Life Expectancy in 6 Large Latin American Cities from the SALURBAL project. And here what we did is we chose 6 large cities. The key reason for choosing them is that they needed to have a lot of component units, a lot of county-like units, so to speak, that allowed us to see how life expectancy varied within these cities, so whether there were inequalities in life expectancy within these cities. And what we did is we computed life expectancy in each area. We estimated gaps, how unequal is each city, mapped it, and also explore associations with area level socioeconomic status. Now, what we found here in this article was we found that there were very wide gaps in Santiago and Panama, Santiago de Chile and Panama City, 15 to 18 years of difference between the highest and the lower levels there. We also found very specific geographic patterns that I'll show in a minute. And we also found quite a strong association with area-level socioeconomic status in 5 of the cities. So as an example of the geographic pattern here, I'm showing on the left here is Buenos Aires, and I'm showing life expectancy here. Darker green is higher life expectancy, so people die later, they live longer. And lighter green will be lower life expectancy, so people die earlier, they live shorter lives. And what you can see here is, for example, within the core part of Buenos Aires is a very clear north-south pattern, where the north has higher life expectancy and the south has lower life expectancy. But you can also see similar patterns in the suburbs of Buenos Aires. Santiago has a similar pattern, Santiago de Chile, where you have high life expectancy in the center parts of the city and going out towards the northeastern part of the city, you have this part of higher life expectancy. Now, I'm showing Santiago here because anyone that knows about Santiago and sees this map recognizes what this map is. And this map is the same map you can find for every single outcome you look at in Santiago. Poverty, income, education, unmet basic needs, whatever you want to look at, you will find a similar pattern, which is emerging from the center of Santiago and going to the northeast. You have this pattern of higher levels of socioeconomic status, higher wealth, lower poverty in the northeastern part of Santiago, which we found reflected in this data. Now, apart from these maps, we also had another interactive application with this that showed some of the data that we could make public at that moment. See if I can show that. It's, as you can see, very similar to the other application. I'm going to put it on the chat here. This was actually the first app I ever built. So it's very basic in its design. But we showed basically a list of all the life expectancy in each of these units for each of the cities. So in Santiago, we can actually look life expectancy in women. We can actually look at the lower values and the higher values here. We can download it with some of the other data, like percentage secondary education. You can see it tends to be lower in these areas of low life expectancy, and it tends to be higher in these areas of higher life expectancy. And we also show the results of several sensitivity analyses here, where you can look at the baseline results of the association of life expectancy with education, but you can also look at other analyses that we actually did here to show mostly very similar results across things. Now, something remarkable about this article, which was very simple, as I said, the only thing we did is compute life expectancy, estimate what's the gap between the lowest and highest areas, map it, and look at how it's associated with SCS. Now, this actually made the news in quite a few places. The article was open access, so whenever we sent it to journalists, we never needed to send the paper. We sent a link, and they were able to access it. Again, same funders, so same requirement. And then this is an example from El País, which is probably the biggest newspaper in Spanish, a Spanish newspaper from Spain, but it has an edition for Latin America. And this is the front page of sometime in December of 2019. And down here at the bottom right, you can actually see our article. It says 18 years less life because you are born poor. Not exactly what we found, but yeah, it's close enough, I think. This will be the result of Santiago de Chile, specifically. And this is to the top left. It will be the beginning of the news piece there. Now, something I want to say is that we actually had a lot of conversations with the journalists here because they wanted to replicate these figures, but the kind of outcomes we were using in the figures were very unintuitive because we were not using just life expectancy. We were using life expectancy adjusted for something else. And that was so complicated to explain that we ended up deciding with the journalists, do the rest of the news piece. Don't show that because it's going to be super complicated to show. So it was a good lesson for us to know that we would have had, I think, much better dissemination had we simplified those results a little bit. But anyway, the other thing I want to highlight here with these results is that we got this, big Spanish newspaper across Latin America, but we also got a lot of local coverage in the areas that we did that. And I think part of that is that we made the results available. You saw that in the app for every city. So someone will go to Mexico City, for example. This is Televisa showing the results for Mexico City. This up here is actually a radio from Colombia, I think. We didn't include Colombia, but they had that. They covered it anyway. But these are all from Chile, specifically newspapers from Chile, La Tercera, La Cuarta, etc. They all cover specifically the results of Chile. Here these are results from Argentina, Clarín, which is the biggest newspaper in Argentina, and Infobae, another very big newspaper in Argentina. Both of them cover results specific to Buenos Aires. We also had from Belo Horizonte, this is a newspaper from Brazil, interviewing one of our co-investigators. And they showed the results specific to Belo Horizonte. So having all of these dissemination products that are freely and publicly available was really helpful here. And it helps us a lot disseminate with media. So in summary, life expectancy is highly unequal. You can see very big differences between and within countries and within cities. And having these public tools is very, very helpful. And the main lesson here to me was it's actually the simplest results that are easier to communicate and that actually generate the most interesting media pieces on this. So ever since that happened to me, I'm always now trying to always simplify the findings here. Okay, now for another example, I'll pass it to Josiah, who will introduce his work on the extreme temperatures and mortality in the region.
Hello, everyone. Thanks so much for the opportunity to be able to speak to you all. So I work within the results I'm going to present here within the same study that Usama talked about urban health in Latin America. And so I'm going to talk today about a paper we published in 2022 in Nature Medicine, again, open access, on the city level impact of extreme temperatures and mortality in Latin America. And I have to give Usama credit. He was not on the author list for this paper, but he was a big part of creating the app, which I think really helped the impact of this paper. So just to give you a little bit of context about what this paper was about, there are these three converging challenges of Latin America related to extreme heat. That's going to make extreme heat, extreme temperatures a very big public health problem in the coming decades. First, of course, climate change is increasing the intensity of extreme heat and heat waves. As Usama mentioned, Latin America is extremely highly urbanized. 80% of the population lives in urban areas. And of course, we know that temperatures in urban areas tend to be hotter than in the surrounding areas during hot months, during summertime, because of the heat island effect, right? Where this heat is captured in buildings and pavement. And so it can feel and be much hotter in urban centers than, at a wooded, forested park outside of a city, for example. And lastly, extreme temperatures are much higher risk for older adults. And Latin America, the population is aging much faster than the global average. So these three things together make extreme heat a very kind of pressing problem that's expected to grow over the coming decades in Latin America. So our study here focuses on 326 cities from the SALURBAL project. These are from the 9 countries listed here: Argentina, Brazil, Chile, Costa Rica, El Salvador, Guatemala, Mexico, Panama, and Peru. The countries that we left out was because of data availability. We didn't have the daily deaths data for the other 3 countries, and so we weren't able to include them. We're looking at temperature, we're looking at mortality, all-cause mortality, and without going into the methods, the basic goal is to estimate the impact of extreme temperatures on all-cause mortality in each of these 326 cities. So a lot of the themes and the lessons learned and the ways that we leverage this interactive apps are over this key point factor in the study that we're looking at 326 cities and trying to describe them all, right? So it can get out of hand quickly. So here is a map of the cities in our study on the right, and the color represents the annual mean temperature. So the blue color means they're colder cities. The yellow color means that these are warmer cities. So you can see kind of warmer areas here. I don't know if you can see my mouse or not, but warmer areas in Brazil, in the tropics. And then this cold line here is in the Andes Mountains where the altitude is high. So even though it's, can be close to the equator, it's very high altitude, so very cold. Warmer temperatures here in the Gulf of Mexico and the Caribbean. So this is, again, a big challenge of this study. All of these cities have very varying climates. So there's going to be very different risk of heat exposure across these cities and risk of cold exposure. We actually have some cities that are very cold within this study area. And also, of course, I mentioned earlier that older adults are more at risk. We have very different age distributions across these cities as well, which will have a big impact on what's the burden of extreme temperatures on health. So when thinking about how to present this paper and present these findings, this key question is, who are the policymakers responsible for all of these cities? And the answer is really no one. I mean, sure, there's international bodies that might be interested in this, but really these decisions about extreme temperatures and health and how to protect the public are ultimately going to be made at a more local level. And that could be at the national level, but it could also very much be at the city level. So how can we present these findings in a way that aligns with the policymakers who might be interested in these findings? So while we present the overall findings in the paper, X percentage of deaths are caused by extreme heat across 326 cities in the entire region, this is a bit limited, right? Because folks may be asking, okay, well, that's great across these 326 cities, but what about my city? Or what about my country? I'm in the Ministry of Health, and I'm responsible for this certain group of cities. I'm not responsible for the rest. What do I need to know? And so I'm not gonna get into the technical aspect here, but I'm just trying to communicate here. For each of these cities, we did these complicated models, and we got the specific results for each city. And so here you can see at the bottom, this is a histogram of daily mean temperatures, right? So every city is going to have a different climate and different weather patterns and going to have a different distribution of temperatures over the course of a year, right? And then at the top here, we have this temperature mortality curve or exposure response curve, right? Where this kind of lines up here on the x-axis with the temperature. And you can see here, this is in Celsius, around 23 degrees is kind of the lowest risk temperature, which is just about room temperature. And you can see as the temperature gets above that, the risk of death quickly goes upwards, right? As you get into extreme heat. Whereas if you get into colder weather, the increase in risk of death goes a bit more slowly. So the thing is that we create these results for each of these 326 cities, and not surprising at all, they're very different from each other, right? So you can just kind of quickly eyeball here these histograms of temperatures. You've got very different temperature patterns in each cities. So that's saying some cities are going to have a lot of heat risk, some cities are going to have a lot of cold risk, some cities are going to have both, right? And then you've got these very different temperature mortality curves of the risk of the temperatures, that are experienced within a given city. And so city-specific results are really important to this project and being able to figure out a way to communicate that to the relevant policy actors. And so that's why we developed this interactive app, which I think was really helpful in this specific problem of this study of communicating the results for hundreds of cities individually. So now I'm going to go to the interactive app. Let me drop it in the chat. Okay. So here is, the cover page, and this is really the information taken straight from the article published in Nature Medicine. We've got an abstract. We have a link to the open access manuscript. And then we get into the results. So here, Usama was talking about the power of maps. Ours is very heavy on maps. So this here, there's different metrics here. I'm going to show here the percentage of deaths due to heat. Okay, so this EDF, that's just a percentage of deaths due to heat. And you can see a lot of variation around the region, right? And so these Yellow dots represent less risk or fewer percentage of deaths, and the purple dots represent more risk of death. So you can see here, again, as you'd expect, in these cold regions I pointed out before, in the Andes, there's very little risk of death from heat, whereas more so in northern Argentina and these other areas. So you can see very kind of clear regional patterns if you have a more regional focus and you want to take a look at your country, see which areas might be at greater risk, etc. And you can also here, it says select age group on the left. We can just look at deaths among older adults if we want to. And before we were looking at across the entire population. So you can just focus on what are the risks from extreme heat for older adults, if that's what you're interested in looking at. And then here, these tabs here, we're actually able to kind of to stratify these results by country, which we didn't actually present in the paper. So using this app gave us the opportunity to break this out in some different ways beyond what was in the final peer-reviewed manuscript. So you can see here, for example, a lot of cities in Argentina and Mexico have high risk of death from extreme heat, whereas in Chile, less so, which is not surprising because it's colder. You can also break this out by climate zone. So more deaths, tropical areas, arid areas, temperate areas, not a lot of risk from heat in polar areas. So then my favorite part of this app is if you go over to city-specific details here, you can actually see all of the findings here for each given city. So here you've got this city-specific temperature mortality curve that I talked about here. But you can click around the map and see the different curve for each city, right? And so policymakers or just people who are interested or scientists or anybody, the general public is able to look. Not that the general public is going to spend their days looking at websites like this, but people who are interested in this are able to go to their specific city and find the temperature distribution and this temperature mortality curve. We include all of the different outputs of different kind of ways that we diced and spliced the outcomes, how we represent the health impacts. You can see here, we just switched it to cold here. And then, of course, for cold, it's kind of the inverse, right? Where you've got a big risk of death from cold in the Andes in these colder regions. And then folks in Brazil are not that worried about extreme cold, at least in the northern parts of the countries. So this is, so we break this out by country, by climate zone, and also we provide the full results for each of the cities in this study. So let me get back to here. So this, in terms of, takeaways or how this helped us, having this interactive app, really, we got a lot of praise for this in the review process. So specifically, multiple reviewers mentioned this as a strength of the paper. And then the editors as well mentioned this as a really important part of the paper, not just because it kind of, you could see under the hood a little bit more and it gave you maybe a little more confidence in the findings, but also that thinking that this could have a much greater impact because of this, again, open access interactive app available to the public. And so I think, so when this paper was published, the Nature Medicine wrote a research briefing about this, which is a kind of more layperson-oriented summary of the article. And they also wrote a research highlight on this, which is just like a one-paragraph, very simple kind of like blog post snippet of the article. And so I think that having the interactive app was very helpful to convince the editors that this would have an impact. And I think that's partly represented in the fact that they wrote up these different formats for the article that were targeted for either a more general scientific or layperson audience. And so, of course, that gave the paper more credibility when it comes to journalism. So this is a map of all of the different publications that cover this article and what country they represent. Of course, we're, very excited to have this covered across so many countries within Latin America who are actually represented in the study. And then we also got coverage by El País, the Spanish language newspaper based in Spain that Usama mentioned, which is the biggest Spanish language news publication globally, as well as coverage by BBC World News, which is global, of course. So in a lot of these articles, it made me so happy, but in a lot of these articles within Latin America, I won't say a lot, I will say a few of them, they very specifically mentioned and were able to pull out the findings for their local area or for their local country. And that came not from us, but from the interactive app. And so what they're reporting the overall findings, but they're also reporting the results that are most relevant to the specific country that media outlet is based in, or who their audience is. So I really feel like a lesson from this is that using interactive apps allows you to present findings at more local policy relevant levels, which I think can really increase engagement in these scientific findings. So I think my two takeaways here are, number one, interactive apps can really help get the attention of editors and scientific audiences because it increases the accessibility of this, complicated, laborious science into something that's a little bit more translatable. And number two, using these apps allows you to present local results and local findings at the level of policymakers, who are the ones who are going to be hopefully addressing or using these findings. And that can really increase the impact and the relevance, I think. So that's the end of, I guess I'll stop sharing. And then my presentation, and I'll pass it on to the organizers.
So, thank you both for presenting, and we're opening the floor up for any questions folks might have. You're welcome to just unmute and ask your question, or if you'd like to put in the chat, I can read it off for you.
I'd just like to comment that your presentation really brings it home that so often it seems that the purpose of academic research is to generate more academic research and just continue the cycle. And I certainly realize, and your presentation really brings it home, that there can be a deeper purpose, that particularly in public health, you're trying to influence policy, you're trying to influence public thought. And that can't really happen when all of the research is hidden behind paywalls and really only available to the rest of the academic world.
Definitely, thank you. Yeah, the part of the goals of the overall project is actually to do that engagement. We have a team of people working on that, I think what's interesting here is that a lot of times when this happens in projects, you have the people doing the science and the people doing the engagement, and they don't talk to each other. But here, a lot of these activities are actually joined, and that's very, very important in this case. So,
one of the things in our project that I found most helpful is bringing a member of our communications or policy team onto the paper, and they will often have really great insights I might not have ever thought of about how to frame the question, how to present it, or even just how to change the wording so that it is actually something policymakers will understand and and be helpful to them.
Is that something that more researchers are doing? They're bringing on, people involved with creating policies and communication staff to help with their articles and how they're framing research, or is that a fairly new and not so common practice? Do you have any sense?
I think it's becoming more common, definitely, because it's becoming more needed and it's becoming more clear that we cannot just publish the papers. We need to do something with them. Now, we are not really trained to do that kind of thing, to do that kind of engagement. So that's why bringing people that actually know what they are doing. How do you talk to a policymaker? How do you talk to media, etc.? It's key. So I think it's in, at least in our projects, it's a key part of it, and I think it's becoming more and more common in more and more projects.
That's really exciting. Thank you.
A fascinating work. I really enjoyed the presentation. Did you say that your project had received renewal funding for another 5 years?
Yep, we should be starting next Wednesday with that funding.
Wonderful.
And we are actually, that's also we've also gotten other funding to create a Drexel Center for Climate Change and Urban Health, which is linked to these efforts. So yeah, we are going to be focusing a lot more on the type of research that Josiah showed, but kind of intermingle with what I presented. So what are the disparate impacts of climate change on health? Who is suffering more of those effects? That's going to be a big focus on this project from now on.
Wonderful. Thank you.
Part of this project, actually, and the future ones, is that we are not only mandated to share the papers open access as part of Plan S, which we are doing and we've been doing for the last 6 years, but we are also mandated to eventually make the data publicly available. And I'm actually pasting in the chat, we are still testing this and we are launching it in a couple of weeks, a data platform that we have created to share some of the results of this project. And in there, you can actually already see some of the data. We'll be finalizing this in a couple of weeks, but you can also see a lot of these papers, we have a catalog of products there where you can see interactive tools that we are doing. Actually, let me show that to you here. This is the website I linked, and here you can go and get the data. You can even look for example, mortality. We have life expectancy here, which you can download. In a week, you will have also temperature and other things. But also you can see the results of our research. You can look here for temperature, and you can see here the different papers we have published on temperature, including the one that Josiah showed here with the press impacts, code, the interactive tools, the paper itself, etc. And we have a whole section here on all of the interactive tools that we have been creating, including other ones that we haven't showed today. So that's another effort on trying to make those results more accessible.
But I'll just say it's a lot of effort, and Usama has led a lot of this, but it's a lot of effort, and it's even more challenging if the funder isn't on board with this. So because our funder is on board with publishing open access, they'll just cover the fee, the open access fee, for any paper that we put out, from this project. So we don't have to worry about that. But if we are finding, obviously that's very important for this project because it's based in mostly middle income countries in Latin America, and we want this to have a non-academic audience who are able to access the research. But if we didn't have that from the funder, we'd be paying $6,000, $7,000, $8,000 in open access publishing fees for each article, and that would be a huge financial burden. I think we'd do it anyways, but it would hurt a lot.
Yep, I'm seeing the comment by Jay on the chat. Completely agree with that. It's definitely, and that's another trend that is actually more and more common now, to mandate and to actually have data being available out there for people to use, and to have a statistical code too. That's the other thing that is becoming more and more common, to be able to reuse that code and to replicate the results. So yeah, and I think an interesting thing here that we are now, that we actually learned through doing this, is that there are tools that can help you archive that code in a way that is permanent, such as I think for both of these papers, Josiah, correct me if I'm wrong, we are using Zenodo to archive the code, because the journal said, look, we know you're using GitHub to share the code, but you can make changes to that. That's not archival. We really want the version of the code that you use for the paper to be archived somewhere. And that's why we had to copy our GitHub repository to Zenodo. And that was new to us. That's something we learned doing this, but it's something that I think more and more journals are now requiring people to do, to have those archival versions of code.
Small question out of that, because you're making these apps to make your research and data more accessible. Have you thought about sort of the rough timeline of like how long you want these apps to be able to be used? Because it does take resources to maintain them with technological changes or like things getting moved that's going to break it. So have you thought about like a little bit of the like what's the timeline of how long you're going to be able to support this in your work?
That's a great question. And that's something that actually worries me, because ideally the papers are there forever, right? They are archived and they are there as part of the journal, etc. Now these apps are hosted in a specific server. What happens if that server goes down? Like, and because the apps are linked from the paper, if we need to change the URL, we are a little bit of in trouble. And that's something that actually worries me. And if you may have noticed that the oldest app has the URL is on my personal account, because back then we didn't even think about that. And the newer apps are on a Drexel account we created for that. So that's a little bit, it worries me a little bit. And actually that old app, one day I discovered there was a change in something and one of the tables wasn't showing up. So I had to go edit a few things and re-upload it. But what happens if I wasn't here anymore, right? And that's something that worries me, but we haven't still established a protocol of how do we maintain them. The good thing is that in general, unless something major changes, the app can continue there and we don't need to do anything. But it is true that there may be some changes that require a little bit of maintaining. And building the app itself, Josiah was much more involved in his app in this regard. It's a very time-consuming project. I don't know if Josiah, you want to talk about how you went back and forth with building that. Mine was easier because it was the first one we built and I just did it and show it and that's it. But with Josiah's one, we actually went through a much more involved process.
Yeah, so I've built the apps in the past, but this one was built by one of our data engineers at the Urban Health Collaborative. But I mean, you can build on the previous apps. So it's basically just lines of HTML code. But of course, for each project, you're going to want to show different things. And so you're going to need to do a lot of changing around because of your results will be different depending on what the type of results will be different. So like, for example, for us, we wanted to have that little image for each city of the temperature mortality curve. And so we had to upload 326, little images to that. And then the app pulls on that image for each page. So, different challenges for each project.
Thanks. If anyone has any additional questions, you're welcome to ask them now. Otherwise, we'll look at letting folks get back to their day. And thank you all for coming out and joining us for our various Open Access Week talks this week.
Thank you for inviting us.
Thank you.